Have you ever wondered why someone engaged in drug use or unnatural behavior like watching pornography? So it all caused by addiction. According to Feldman 2023, addiction is the inability to stop using substance or engaging in activity despite harm. It is caused by our pursuit of survival and pleasure. As it deeply tied to the brain's reward system, we intend to discover the intricate relationship between dopamine and how it causes addiction.
Dopamine is a main catecholamine neurotransmitter produced in the midbrain, specifically in the strata nigra and the ventral tegmental area. Dopamine is synthesized in both central and peripheral nervous system and is bind to the G-protein coupled receptor. Dopamine is important in coordinating smooth and controlled movements, involved in the regulation of mood, and also involved in certain cognitive tasks. Dopamine is also important and has a significant role in the brain's reward system, which is what we will focus on. The brain's reward system is a complex network pathway that creates pleasure, reinforcement, and motivation. Dopamine DA that is released in the nucleus accumbens creates the feelings of pleasure and satisfaction. DA acts through the mesolimbic pathway to control behavior related to rewards. Other affected regions are the subthalamic nucleus and also a supplementary motor area.
This is an example of drug use. Today we are going to explore the relationship between cocaine and dopamine. Starting with the mechanism, cocaine blocks the reuptake of dopamine, which means dopamine stays longer in the brain and continues to stimulate its receptor. This leads to the feeling of euphoria and increase of energy. Regarding to the addiction cycle, over time, the body builds up tolerance, requiring more cocaine to achieve the same effect. Research by Bolko et al. 2011 shows that using cocaine in a rapid method like smoking or injecting produce a more intense high, making addiction more likely.
La ibu panggil. La. Hola.
Pornography consumption has become increasingly prevalent in today's digital age, leading to a significant impact on the brain's reward system. But what exactly happens in the brain when we consume pornography? So, the basic mechanism of pornography addiction is like this. Sexual arousal from pornography triggers the release of dopamine. This dopamine release reinforces the behavior, making it more likely for the individual to seek out this stimulus again. Then, pornography acts as a supernatural stimulus. What is supernatural stimulus? It basically says that the pornography provides an exaggerated form of sexual stimulation, leading to a higher dopamine release than what is typically experienced during natural sexual activities. So how does the addiction process happen? The first step, initial exposure to pornography leads to a surge of dopamine, creating a powerful reward signal in the brain. However, over time, the brain starts to desensitize to this constant dopamine flood. Desensitization occurs, requiring individuals to seek out more extreme content to achieve the same level of arousal and pleasure. This leads to escalation and dependency on pornography, similar to the pattern that can be seen in drug addiction. What are the consequences of having a porn addiction? So basically, individuals may struggle with anhedonia, making it difficult to find joy in everyday activities. Relationship can suffer and mental health issues such as anxiety and depression may arise. A study conducted by Woon and colleagues in 2014 at Cambridge University found that brain activities in individuals with compulsive sexual behavior or CEB, in simple terms porn addiction, is similar to that of drug addicts. This indicates that pornography addiction engage similar neural mechanisms as substance addiction.
There's an example of Parkinson's disease. Parkinson's disease is characterized by dopamine deficiency, leading to motor and non-motor symptoms. The treatment usually used for Parkinson's disease are dopamine agonists and levodopa. However, dopaminergic treatments can lead to compulsive behaviors such as pathologic gambling, hypersexuality, and compulsive shopping. Besides, it also causes dopamine sensitization, which is a process by which repeated exposure to a stimulus such as drugs can lead to an increase of dopaminergic response over time, particularly in ventral striatum, which is located in the center of the brain just behind and above your head. It plays a critical role in development and persistence of addictive behaviors. There are several studies on the relationship between Parkinson's disease and dopamine. For example, Evans and his co-worker measured the dopamine release in Parkinson's disease patients with and without medication addiction after a dose of levodopa by using PET scans. The result shows that only the addicted group shows significant dopamine release in their ventral striatum, indicating dopamine sensitization. On the other hand, Layton and his co-workers found similar dopaminergic response in high novelty-seeking young adults by using amphetamine. Both studies shows a linking between dopamine release in ventral striatum and the reports of drug wanting.
From this research, we hope you get to understand the role of dopamine as the vital neurotransmitter in the brain's reward system, and how the release regulation can cause substance and behavioral addiction. Through the relationship between dopamine and Parkinson, we know that the treatment of Parkinson's disease can cause compulsive behavior that highlight the needs of balanced dopamine level in our body system.